Okay, you walk up on a scene and all of a sudden there's someone laying there and they're injured. And you're the only person around. How are you going to help them? Well, luckily you're in your boy Nichols science class. What up, fam? I'm going to teach you about the NOLS, Wilderness First Aid Patient Assessment Triangle. And so this triangle will give you the tools that you need to be able to help someone, whether it's a friend or just a random person, that if you come across them and there's no one else around to help and you can't call an ambulance, you got to be able to help them the best that you can. So let's think about this. We just learned about the human body, and you know about how it works a little bit better. And so what we need to do is we need to help this person's body work a little bit better because they just got injured. So you should have this page taped in here to your science notebook, and we're going to dig in deep to fill out this page here together so you can understand how to assess a patient that you come across if there's no one else around to help you out. Okay, so this is a triangle, and we're going to start here at the top, and we're going to work our way towards the bottom as we go. So what you need to do is you need to take some notes here with me because you're going to actually do a scenario where you're going to have to act all of this out. So the first thing you need to do when you arrive, the very first part, is the scene size up. The scene size up is basically a chance for you to take a really quick look. Now, this is just going to take a few seconds. Let me get a smaller pen. This should only take you maybe 10 to 20 seconds to do your scene size up. Essentially what you're doing is you're looking for hazards. And this is a hazard, meaning like something that might hurt you if you tried to help this person. Like maybe there's a bunch of trees around that one fell over and there's some others that are about to fall. You'd want to look for that potential hazard so that that tree doesn't fall on you when you're trying to help someone. Because if you get hurt, then no one's there to help. You're also looking for hazards for maybe hurting the other person. Okay, so you want to make sure that there's no immediate danger to you or to anyone else who's just like around watching. Like if you had a younger sibling or something who's just around hanging out with you, or you're out hiking with a friend, you want to make sure no one else can get hurt and that the patient isn't going to get more hurt. Then what you need to do is you need to like just look and say, okay, what do I think happened to this person? Okay, so why are they injured? You just got to come up with your best initial, if you can't talk to them or anything, why are they injured? So if you see that their leg is like bent backwards, well, you can probably get an idea of why, or even we'll say how or why they're injured. So you can say, oh my gosh, their leg, that looks crazy. That's not how it's supposed to be. So maybe I should help them. Okay, another thing is you might come up to someone and if a tree just fell on them, or if maybe they ran into a rock or they fell from somewhere, they might be a little bit bloody. So something you need to do is you need to make sure that if they're bleeding really, really bad, that you stop that bleeding. So we need to make sure that we stop, let's call it bad bleeding, because bleeding is not good. But if it's really bad, then you need to stop that really bad bleeding. If it's just a little bit of blood, we'll take care of that later. But if they're gonna lose a lot of blood, we want to make sure they don't lose a lot. So you gotta kind of stop that by putting pressure on the wound or the thing that is bleeding. You just add pressure and it helps stop the blood vessel from pumping blood out of the exit wound. Okay, the last thing you need to do is make sure that you know the number of patients. So if you just see one person, that's fine. But you need to make sure, hey, is there anyone else that's with you? That'd be a good first question to ask after you kind of get to know and ask the person's name. So we need to know the number of patients. Again, this is 10 to 20 seconds. So what that looks like is you walk up, you look around, you take a look. Are there anything else that's going to hurt me or anyone else? You look at the person. Why are they injured? Maybe their leg's the wrong way. So you get a general idea. But if they're bleeding really bad, we need to stop that bleeding, and we need to make sure that we need to make sure that they are the only patient and that there aren't any others. So we need to check for that and make sure that we know all the patients that are there. Okay, the second thing that we need to do is we need to look for life threats, meaning like something that might threaten their life is an easy way to say that. So a way to remember what to do after you've done that 10 to 20 second scene size up is initially what you need to do is you need to identify yourself. Say, hey, I'm blah, blah, blah. Can I help you? And you know what? If they're hurt, then they're going to say yes. But you should ask just to make sure. And the first thing you want to know about is whether or not they can use their respiratory system. So you're going to look at their airway. That's the first thing. Now, if they're talking to you, that's a general, immediate giveaway that their airway works because they're able to breathe. If they're not able to talk to you, then we need to check their airway. Okay, we need to look in their mouth and see if there's anything stuck. If there's anything in their mouth, maybe they were choking, well, we need to figure out a way to get that out. Maybe they have some blood coming out of their mouth. We need to check and see, well, where is that coming from? The next thing we need to do after we check their airway, we need to make sure they can breathe. So we're going to check their breathing. Okay, maybe their airway is not, there's nothing in their airway and they're breathing, but if they're breathing and their breathing is like, sorry, but if it is breathing like that, then that gives you information. So we want to know about their breathing. So we need to look and listen to their breathing. And when we look, I mean, like, watch their chest. Is their chest moving really fast? Are they taking deep breaths or short breaths? That's what we're looking for, is the quality of their breathing. Next, C is circulation. We want to make sure that their circulatory system is intact. So circulation, we need to see, do they have a pulse? If they have a pulse, that means that their heart is pumping. If they don't, then their heart's not pumping, and that means that we need to initiate CPR. If there's anything that's going to cause them, maybe like threaten their life because of bleeding, we need to stop any unnecessary bleeding that might be happening. Even though we already checked for that in the scene size up, it's now a good time to reassess and say, hey, is it getting worse? Is there anything that needs to be addressed to help their circulatory system? So the airway, breathing, circulation. D stands for decision. Well, let me write decision. It's not how you spell decision. Decision about their disability. So they're not able to do something, and that's why you're helping them. So they have some type of disability, and we need to make a decision about their disability. Like if they just fell off of a rock like 10 feet high, then maybe they hurt their spinal cord, and we don't want them to become paralyzed. So we'd say, hey, you probably shouldn't move right now. Okay, so the most important thing in the decision about disability is, do you think that they could have maybe broken their back? Do they have a spinal injury? Now, if they just got struck by lightning, the decision about their disability is not going to require a spinal injury. That's probably not, they probably didn't hurt their spine if they got an electric shock. So you want to think about whether or not the spine has been compromised. If it is, this is the point we need to say, hey, just please don't move, because your spine, you might have done something that could have, hurt your spine. And that's where all those nerves run through that give us all of our awesome abilities to move and run and jump and talk and eat and digest our food and all that good stuff. E stands for expose. Now, you got to be careful here, because you don't want to just take somebody's pants off if they have a cut on their knee. So instead, you just ask them, hey, can you roll up your pant leg so I can see the cut? Because if they are bleeding, we need to make sure that we can clean the wound and put a wound dressing on it or a Band-Aid on it. If they hurt their ankle and they say their ankle hurts, we need to see their ankle, because if it's already swollen and it looks like someone put a golf ball in there, that's going to be good information for us to know. So expose, we need to see the injury so that we can then help them and fix it. All right, so we do the scene size up, we go through the life threats, we check their airway, look in their mouth. Are they breathing? Look and listen to how they're breathing. Check their pulse. Do they have a pulse? Okay, move on to decision about disability. Is it going to hurt their spine, or did they hurt their spine? If no, then go ahead and move on to see the injury that they do have. If they did hurt their spine, then we need them to stop and stay exactly how they are without moving. The third thing you're going to do is called a head to toe. So the head to toe is a way to maybe check their full body, because, if they did just get struck by lightning, they might be like, oh my gosh, I just got struck by lightning. I feel really weird. But what they might not realize is that when they got struck by lightning, they might have fallen to the ground and maybe broken a finger, but they can't tell because they're so amped up about getting struck by lightning that they might not understand that other things happened. So since we're the rescuer and we're the calm one, we do a head to toe. So we want to scan their body for other injuries. And so what this means is just saying, hey, can you move your fingers? Can you lift up a foot? Are you able to walk? You would maybe feel your way down their arm and kind of just lightly squeeze their arm to say, hey, does anything here hurt? Because maybe there is a broken bone underneath their skin that you can't see, but when you put pressure on it, they feel that pain. So doing a head to toe means you just kind of check their legs, make sure their legs aren't injured, or that you kind of like push on their calf and you squeeze their ankle to make sure that there's no other injuries, and that they can move their hands, they can move their toes. They know their right foot, so you can kind of tap their right foot and ask them, what foot am I tapping on? And they should be able to say, that's my right foot, that's my left foot, and so on. So you want to make sure that their body is all good except for that one injury that they have. The fourth thing that we do, let's switch up some colors here. Number 4 here are the vital signs. Vital signs are essentially like, hey, can they talk to you? So we need to know the level of responsiveness. And the level of responsiveness is basically like, do they know their name? Do they know where they are? And do they know the time of the day? And do they know the events that led up to the injury? So if the answer is no to any of these questions, then that's really important for us to know, because that means that their brain might not be working very well. They might have a brain injury if they don't know their name, they don't know the place that they're at, they don't know the time of the day, or they don't really know the events that led up to their injury. So it's important to ask those questions. Say, hey, what's your name again? And you want to ask again, even if you know who this is, you want to know if they know who they are. So you'd say, hey, what is your name again? Where are we? What time of the day is it? And if they don't know that it's 2:36 p.m. and they know that, hey, yeah, it's a little bit after lunch, that's okay. And then they also need to be able to repeat the events that led to that injury. So as an example, someone that gets a concussion, they actually can't do all of these things. They sometimes can't remember what caused the injury. Sometimes they don't know what time it is or where they are or even their name. And so that means that they have a different level of responsiveness than what we would expect them to have. And that means that there's some type of brain injury. So it's really important to check their level of responsiveness. Some other things to check are heart rate. So you could use your fingers and put your fingers on their wrist, set a timer for 15 seconds, count the number of heartbeats, and then multiply times 4. So we need to check their heart rate. You can also check their respiratory rate. You can do this by just watching their chest rise or fall or listening to their breath. So these are all really important vital signs to be able to understand about somebody. All right, number 5. This is history. In the history, you want to know about who they are, basically. So you're going to ask them their name again, because it's good to just ask them again so we can check their level of responsiveness, see if it's changed. You want to know their name. You want to know their age. You want to know if they take any medications, because maybe it was the medication that caused this injury, or maybe this medication caused them to feel like they're feeling. We need to know things that happened in the past, like things that they might do in the past, or their normal things. So we want to know their name, their age, their medications, any allergies they might have. Because if you know they have like a bee allergy or a peanut allergy and they just ate peanuts, like this is good history to know to try to solve the problem. So name, age, medications, if they've taken any, allergies if they have any, and this is a good place to start. Now they might tell you some more information about their history, and this is good. Take that in and use it as you come up with your plan to help them. So what you need to do in step 6 is you should at this point know what is the main problem. So we need to try to provide comfort for this person. You know, if you have a cut on your arm, it's comfortable for it to get washed out and a Band-Aid put on it. You feel a lot better after that happens. So we need to figure out what's the problem, how can we fix it, and then what is our plan to help this person. We need to try our best to provide comfort. Now, if it's just a cut on the arm, then we can give them, our plan can be to just give them a Band-Aid, to clean out their wound. And so as you research the thing that you want your patient to have wrong with them in your scenario when you do the acting, you need to learn about how do you actually take care of someone with that injury. So if they have a sprained ankle, You need to figure out, what do you do? What's the plan if you find someone with a sprained ankle? If you find someone who's hyperventilating, that plan is going to be different of how you take care of someone who's hyperventilating. You don't tape their ankle. You don't help them in that, because that's not their problem. So we need to make sure we know what the problem is, and we'll learn it by doing all of these steps 1 through 5. And then we need to come up with a plan. And so your goal for this double black diamond assignment is to learn and research about a problem and how to solve it. So you're going to learn about how you take care of someone with that problem. And then you're going to create a scenario as if you were to walk up on them and you didn't know who they were and they're sitting on the ground with this injury. You need to approach them as you're a random hiker and do a scene size up. Check their A, B, C, D, E's. Do a head to toe. Make sure there's not any other injuries. Check their vital signs. Ask their history. And then help them with their problem with the plan that you research. All right, guys. Good luck out there. And girls too. Help your friends. Learn about how to take care of somebody. If you were to just randomly come up on someone who is injured. Because, you never know. You might be out on a hike without cell phone service and you might have to help a friend who ends up with an injury. All right, I look forward to seeing what y'all come up with. Let me know, because I can help you out. Come up with scenarios, research problems, and learn how to implement appropriate plans. All right, I'll see you guys on the flip side. Y'all.